After the next speaker, we'll move to the votes, but now I call to submit on the main motion Danny Chambers, parliamentary candidate for Winchester.
Morning. So I've been scribbling away trying to capture the opinions in this debate, and it turns out the only people who have worse writing than doctors are vets. So now we're going to see whether I can actually read what I've written. But thank you to everyone who spoke, because we had interesting input from people like David Nichols and other medical professionals giving their expertise. And we had people like Catherine Macy and others giving their personal experiences, which was very powerful. Many speakers spoke about how the inequality between rich and poor and how it's getting worse under this Conservative government. And it is indeed shocking that a girl born in a wealthier area of the country can expect to live 19 longer years of healthier life than a girl born in a more deprived area. And since 2015, the Conservatives have slashed spending on public health, more so in more deprived areas. Now, both my medical training and my experience of working in global public health programs have taught me again and again that it is always more cost-effective to prevent a disease than it is to treat it. But our healthcare system, it is increasingly focusing on treating people in hospital once they've become sick, rather than focusing on keeping them healthier in the first place. So just last Monday, I was out in Winchester and I spoke to a nurse who works for the Diabetes Prevention Programme, which many of you may have heard of. In 1 year alone, it prevented 18,000 people from developing diabetes. And she is telling me how worried she was that the funding for that programme is being cut. Now, quite clearly, the budget for this programme, cutting the budget for this programme won't save the NHS any money in the long run, because thousands of more people will then require long-term and expensive treatment of this terrible disease. Because this approach, it is akin to buying more fire extinguishers because you're removing the smoke alarms as a cost-saving exercise. Now, I totally understand that some people in this room are genuinely worried that the policies in this motion are creating a nanny state. But I completely disagree, and I'll tell you why. It is a call for a proactive government that not only delivers treatment when people fall ill, but it also takes decisive steps to safeguard their health and prevent illness from occurring in the first place. Because when the evidence is clear, as with smoking bans in public places and with seat belts, it would be negligent for a government to ignore measures that will improve and save lives. So I urge you to keep our commitment to the sugar tax in this motion, because rarely has a policy been so successful. But don't take my word for it, because these are the stats. Between 2015 and 2019, the total amount of sugar in soft drinks has been reduced by over a third. Now, that is over 48,000 tons of sugar that has been taken out of our collective diets. Of course, people should be free to make their own choices, but we need to empower people to make healthier choices. And as for the cost, I was involved in our food and farming paper, which is being discussed tomorrow. We are putting forward several measures that would decrease the cost of healthy foods for struggling families. Now, I also urge you to vote down Amendment 2 on single-use vapes, because these are an environmental disaster in an age where we cannot afford it. Now, it's interesting to hear the discussions about Liberals not liking bans, which I totally understand. But the substances in the vapes are not being banned. They are still available in the legal vapes.
Please draw your remarks to a close.
Okay, keeping single-use vapes, they're as environmentally irresponsible as single-use plastics. So I will finish there. I'll urge you to vote against Amendment 2, retain the lines in the separate vote, and finally vote for this motion as a whole. because this motion is a vital part of our plan to save our NHS, make our country a happier and healthier place to live, and turn our NHS from being a national sickness service to a national health service. So thank you, conference.
Thank you, Danny.